Okay, at ngayon po kasama natin Dr. Philip Gatue, isa pong napakagaling na physician, acupuncturist at practitioner po ng traditional Chinese medicine. Doc, ito meron tayong bagong inaprubahan ng Food and Drug Administration na traditional Chinese medicine, yung Linhua Xingwen, ano? Pero ito ba ay inaprubahan ng FDA for use of COVID patients? Para sa COVID ba ito lang?
But to be precise, let's see what it means first. Ano ibig
Oo.
sabihin nung it was approved for COVID? Which means,
Mm.
for me, personal interpretation ko, ibig sabihin nun, kahit anong kaso ng COVID, pwede siya.
Mm.
But that's not the case. Hindi
Oo.
po yung totoo.
Oo.
Ganito lang po sabihin natin.
Mm.
It was approved as a traditional medicine.
Mm.
Meaning, pwede siya gamitin ayon sa traditional use niya. Ano
Oo.
yung traditional use? Yun yung alam na tao na gamit niya mula pa nung mga long time ago.
Mm.
For example, sambong is known sa atin ngayon as one of the DOH 10 herbal medicines, and it's used scientifically validated for some urinary problems.
Yes,
But
oo.
that's not its traditional use. Its
Mm.
traditional use is actually for cough.
Mhm.
So we see a traditional use and a modern use.
Mm.
So ang Lianhua is approved for its traditional use, which
Mm.
is a particular kind of ubo.
Oo.
Kailangan ganito yung ubo, otherwise hindi siya pwede.
Mm.
So ano yung I will leave it to people to look at it. It's all over the news naman, but to reiterate, may lagnat, inuubo, may wheezing, or parang hinihika, maski hindi hinihika, parang yung
Mm.
huminga, parang may tubig
Mm.
ganun. Pag hindi ganun yung ubo at hindi nilalagnat, hindi ito dapat gamitin.
Mm.
So, pwede ba to gamitin sa COVID? Yes.
Mm.
Kung ganun yung presentation or kung ganun yung itsura ng pasyente.
Mm.
You're not treating COVID, you're treating ganitong klaseng ubo.
Oo,
It
the
just so
symptoms,
happens
oo.
that particular constellation of symptoms.
Oo.
Diba? Parang parang ano, parang naghahanap ka ng naglalagay ka ng job application
Mm.
or nagsi-screen ka ng job application. Kailangan graduate ng ganitong kurso,
Mm.
kailangan ganitong edad. So
Yeah.
pag hindi ganun yung qualifications, hindi siya pwede.
Mhm.
Same thing here.
Mm.
Diba?
So,
That's the best way I
oo.
can explain.
Okay.
Now,
So,
meron bang
yeah.
ibang sakit na
Mm.
pwedeng magkaroon ng ganong ubo? Meron.
Mm.
Ang kaso, pwedeng ganun ng ubo. Sipon, pwedeng ganun.
Mm.
So anything na ganun yung ubo, pwede siya. So usually viral. Kasi pag bacterial, bibigay na ako ng antibiotic.
So parang lumalabas, Doc, na kahit na hindi COVID ang pinagmumulan ng simptomas
Yes.
ng ubo, pwedeng ibigay itong Linhua na ito.
Yes, that's what it says in the registration papers.
Okay, oo.
I've seen the registration papers. Traditional use for this kind of cough.
Mhm.
So, pag tinanong mo sa akin, was it approved? Inapprove ba siya for COVID? Ang sagot ko, no. Pero pag tinanong, pwede ba siya gamitin sa COVID? Yes. Kung ganun yung ubo.
Mhm.
So, ang susunod na tanong, uunahan ko na po kayo, pwede ba to gamitin for prevention? Ang tanong ko tuloy, pag prevention, ibig sabihin, wala pang simptomas.
Oo,
Pag wala
oo.
pang simptomas, pwede ba siya dun sa sinabi ko?
Oo.
Hindi. So, pag walang simptomas, hindi siya pwede gamitin for that. Pag nakatubo na at matindi na yung pulmon niya, it does
Hindi
not
na
fit the
pwede.
picture, hindi rin siya pwede gamitin.
Oo,
So,
oo.
very specific yung clinical picture kung kailan siya pwede gamitin.
Oo.
Pero kasi,
Yeah.
I'm sorry.
Paano yung iba? Kasi yung iba naman, Doc, actually, hindi inuubo eh. 'Di ba? Kapag may COVID sila, wala sila nung ubo pa. Lagnat lang. So, kung may lagnat
Yes.
pa lang, pwede na bang gamitin itong Linhua, Doc?
If we follow the guidelines, no.
Okay. Oo.
Very specific siya. That's one thing na gusto ko sana maintindihan ng ating mga kababayan. Ano ibig sabihin ng indicated for a disease and indicated for a certain kind of set of symptoms? magkaiba po nga po yan.
Okay. So, hindi pala dapat basta-basta iinom niya. At saka, yan ba, Doc, ay prescribe lang, no? Ng doktor?
Yes, it's by
Hindi pwede
prescription.
na bilhin over the counter.
Ideally, no.
Oo.
Actually, hindi dapat. Para siyang antibiotic or antiviral. Why? Kasi pag mali ang gamit, at best, walang mangyayari. At worst, you get side effects.
Ano
Na
bang
hindi
side
naman
effects
kailangan.
niyan, Doc?
Well, I have not seen the side effect profile study.
Pero ito, Doc, ano ito, ha? May clinical trial ba ito, Doc? Itong Linhua Xingwen. Okay, tingnan nga natin uli yung si Linhua. Ito, kasi ilan po sa mga health kits daw na dinidistribute ng Chinese embassy sa iba't ibang bansa to overseas students include Linhua Xingwen capsules. Ano ba ang ginagawa nitong medicine na ito? Ano ang kanyang ginagamot? Ang sabi nga ni Doc, mga ubo ang ginagamot nitong Linhua Xingwen, ano? At hindi naman ito talaga. Yes, Doc, oo. Oo, yes. So, sinabi mo nga kanina, Doc, na ito ay para sa may ubo na ano. Oo, at hindi ito over the counter, Doc, ano? Tama ba? Medyo nawawala lang si...
No, it's not over the counter. Also, in China and in other places with significant Chinese population, some things might be over the counter, pero sa Pilipinas, hindi ko siya ina-encourage na over the counter. Bakit? Kasi, kaya nga siya traditional because it's based on the culture. And in the culture of Chinese and Oriental, Chinese, Japanese, Korean, Vietnamese, yung meron silang tinatawag na sakit dahil sa init ng katawan, sakit dahil sa lamig ng katawan. So, pag ginamit mo yung maling gamot, mali. The problem is, sa kanila, sanay na sila sa ganun.
Yeah.
You don't have to explain it. Sa Pilipinas, westernized tayo, we're not familiar with those traditions. So, anong malay natin if I tell you right now, oh, your cough is due to cold, damp phlegm. Ano sa isip mo, ano pinag-uusapan nito? The problem is, the herbs are specific. For cold, damp phlegm, for non-cold, damp, for heat, for fire, deficiency heat, excess heat. Yung mga native Chinese and Japanese and Koreans, alam nila yan. Nakita mo naman sa mga Korean drama nag-acupuncture, nag-herb sila. Natural sa kanila yun.
Yes,
Sa atin hindi. That's why I think to use Chinese herbs, we have to have it given by licensed practitioners or MDs who are aware of how to use them. Sa ngayon, wala tayong licensed practitioners. Ako, I'm a practitioner but there's no license governing my practice. Acupuncture, there's no license governing the practice. Buti pa sa Amerika, meron. Pero sa Pilipinas, wala. So, what should be done is, we can do the Japanese model, which is the MDs are trained and they know how to use them.
Okay, so paano, kailangan ba ng parang advice, guidelines para doon sa mga gagamit nitong Linhua na ito, Doc, dito sa ating bansa?
Yes, that's the nice part about that. Yun ang maganda sa FDA, may approval. Nandun klaro lahat. Just kung may mga misconceptions, I'll be glad to teach it sa mga med students and med schools. Doesn't have to be long, just the basic principles. I don't expect MDs to come up with their own formulas. Pero how to use yung mga readily available, it's a useful skill. That's how I see this. We're not competing with Western medicine. We're adding more weapons. Dinadagdagan natin yung mga tools na pwedeng gamitin ng mga doktor kontra sa mga sakit na ito.
Oo. Pero ikaw, Doc, bilang isang traditional Chinese medicine practitioner, ano ang... And MD, of course. Physician ka talaga. Tunay kang doktor. So, ini-integrate mo yung kaalaman mo sa traditional Chinese medicine at saka sa Western medicine, no, para gamutin ang iyong mga pasyente. Anong ginagawa mo ngayon, Doc? Meron ka bang unique approach sa mga mayroong COVID?
disclaimer, I don't handle COVID
Okay.
patients directly,
Mm-mm,
but
mm-mm.
I have colleagues who ask me about it and get my
Yes.
advice.
Mm-mm.
So telemedicine, sometimes I look at the pulse, I look at the tongue,
Mm-mm.
I ask for the symptoms, and then I give advice. Although now the advice is mostly, sige, gamitin mo Lianhua kung meron ka. This was
Mm-mm.
before FDA registration.
Yes, oo. Mm-mm.
Ngayon, it registered na siya, so I really feel that we have to do things properly.
Mm-mm,
Eh,
mm-mm.
minsan kasi nandyan na eh.
Mm-mm.
I don't encourage people to go buy, period. Pero minsan,
Mm-mm.
nandun na. So I tell them, no, don't use Lianhua. I don't
Mm-mm.
know where you got it, but don't use it.
Mm-mm. Mm-mm.
Sometimes I'd say, yes, you can use Lianhua, but let's wait for the official FDA guidelines.
Mm-mm.
But in theory, pwede.
Oo.
I take the time to educate. Kaya
Okay.
nga, a lot of other doctors, they're saying, ay, sana meron na sa Mercury para we can
Mm-mm.
prescribe.
Hindi pa available ito sa mga drugstores natin, Doc.
As far as I'm concerned, no, because hindi pa finalized. I think they're finalizing the packaging because, see, this is how the FDA also does its job.
Oo.
The packaging must be accurate and misleading. And
Ah,
sorry, and not be misleading.
oo. At kailangan may English translation, ano?
Yes.
Oo.
That's what I heard. I'm not
Kasi syempre
I'm
mabasa
not
natin.
privy.
Oo.
Ako,
Kaya,
nababasa ko yun.
oo
Eh,
nga.
iba. Diba?
Ikaw lang nakakabasa yan, Doc, at saka ibang
Ay, hindi
nakakaintindi ng
naman.
Chinese characters. Oo. Pero Doc, kung gusto nila magpatingin sa'yo, ngayon, may pamamaraan ka nang maibibigay sa kanila. Kung kunyari, nagsisimula pa lang naman yung mga simptomas ng COVID, pwede sila magkonsulta na sa'yo online.
Well, not necessarily me.
Mm-mm.
They can encourage their doctors to send me a message.
Mm-mm. Mm-mm.
Madali naman ako hanapin sa FB, and
Mm-mm.
I'll be glad to help them with their patients.
Oo.
Because it's
Philtan
their
Gatue. Oo, yan ngayon ang pangalan ni Doc.
it's their patient. Eh.
Oo.
I see myself as just somebody na tumutulong.
Mm-mm.
Hindi ko ayoko na naging pasyente ko dahil
Oo.
lang dito. Sila yung mas expert sa akin sa pulmonology, sakit sa baga. Sila yung mas expert sa akin sa infectious diseases. Tumutulong lang po ako. Just
Mm-mm.
trying to help them use yung kagamitan na pwede nang gamitin.
Pero nakakapagpatuloy ka pa rin sa acupuncture, Doc, kahit na ganito ang sitwasyon natin.
In PPE, yes.
Talaga naka-full PPE
Naka-mask
ka
ka,
rin.
naka-face shield,
Naku, hirap.
naka-gown. Hirap. Well,
Oo.
nakahanap ako ng magandang PPE na medyo, hindi masyadong mainit. Nakakalawa.
Oo.
Pero I've limited my clinic hours kasi
Oo.
I understand na I don't want people traveling also
Yes,
unless they
oo.
have to. So halos lahat ng pasyente na tinitinan ko, yung mga talagang hindi makahintay or
Mm-mm.
mga talagang
In pain na
tuloy-tuloy yung
sobra,
treatment.
oo. Oo.
Or kailangan tuloy-tuloy yung treatment, otherwise mawawala yung progress.
Saan ka ngayon nagtitreat, Doc?
As of now, I'm only seeing patients in 2 locations, PGH FMAB and Oasis Acupuncture Clinic in Quezon City.
Okay.
I'm only and since MECQ, I stopped the PGH clinic.
Okay. Pero
Pagbalik ng ECQ, pwede na siguro.
GCQ, oo. Anyway,
Kasi
mm-mm.
public transport is difficult.
Of course,
and
oo.
like that.
Mm-mm.
So, mahirap na.
Anyway. Doc, thank you so much at mag-iingat ka lagi. Mahirap na ang sitwasyon
Yes.
natin ngayon. Thank you so much. Doctor, yes.
Nakakainis nga sa mainland China, halos back to normal na sila.
Oo nga. Kailan kaya tayo magiging ganon, Doc? Anyway. Yes.
We can hope and pray, and hopefully with more drugs and more treatments that we can use, we can send patients home faster. Hindi na ganun ka punong-puno. That's our goal eh. Mas mabilis sila makauwi, na magaling, hindi na sila lumubha na maging severe. Anything that we can use, properly examined by science, of course. Anything that we can use to achieve those goals, we should give it a chance.
Yeah. Anyway, yan po si Dr. Philip Tan Gatue, isa pong physician, isang traditional Chinese medicine practitioner, at isa rin pong acupuncturist. Doc, thank you so much and good evening.
Hindi din po.
Maraming
Seryoso,
salamat.
maganda yung background ko.
Yes, ang ganda, Doc.
Ginugol ko
Thank you
lang
so
yan eh.
much. Maraming salamat.